Welcome to Medically Speaking. My guest today is Mary LaRowe, the interim CEO of the Upper Allegheny Health System. Mary, thanks for joining us today.
Thank you, Mike. Happy to be here.
So you certainly come at an interesting time into the position as interim CEO. You've had the last few years at Brooks Memorial Hospital down in Dunkirk, Chautauqua County. If you can, your time as interim thus far, the last few months, give us a sense of what the system is like, what your overall impression is of the community, the staff, the docs. How's it been since you've taken that interim assignment?
Yeah, I'm happy to, Mike. I've had some idea of what the services that Upper Allegheny has provided in the past, but I have to admit, I was impressed with the scope and the level of care the organization offers its community. It's rare for a rural facility to have such an array of services. Additionally, the commitment of the staff and the providers to the facility and the community it serves is exceptional. A significant amount of effort has been put forth to recruit new physicians, and this all occurred prior to my arrival, but we're now benefiting from all that effort, a true testament to meeting the needs of the community.
So part of that need of the community meeting the needs is the COVID-19 battle. It's March 2022. We hit the 2-year mark of COVID coming to Western New York and Northwestern Pennsylvania. If you can, give us a little sense of Bradford and Olean, the hospitals, what they're dealing with COVID-19. Are cases up? Are cases down? What does the statistics tell you?
Well, like all hospitals across the country, we're now focused on addressing the impact of the pandemic, which includes a significant workforce shortage. We've utilized agency staff to address the Great Resignation, and we're making a concerted effort to recruit and retain our personnel. Recently, we've seen the number of COVID-19 patients on an inpatient basis decline, which we hope signals a resolving pandemic. However, we're not out of the woods yet, and we continue to advocate for vaccinations. One good sign is, though, that the patients that are admitted with COVID are not requiring the intensive care that they did in the past wave.
Well, you mentioned staffing and the staff there at Upper Allegheny. There's a national crisis right now when it comes to healthcare staffing, whether that's a nursing shortage. But you add on top of it what you've faced, especially with the hospital in Olean and in New York State with the vaccine mandate. You have staff that are leaving to become agency nurses. How have you guys managed through this? And, if you can, tell us how the staff has responded to the crisis and how they've risen to the occasion.
Yeah, and I hope I give them justice to this. The Upper Allegheny team has been phenomenal. Many of our leaders stepped up to fill in a need with little hesitation, and I couldn't be more proud. It's not been easy. Prior to the pandemic, we had a nursing shortage that was in full play. The pandemic only exacerbated the shortage. Nurses who were at the front line of the COVID care experienced extreme stress, and many decided to retire, find different work, or to take advantage of the increasing salaries available to travel nurses. Upper Allegheny has addressed the nursing and other workforce challenges, which also include other frontline workers, with new recruitment and retention efforts. Although we are early in our efforts, we are starting to see some results and we remain optimistic, but there's still much work to do.
We're in March. We're close to the end of Q1. You've obviously have faced significant challenges with COVID-19, the staffing crisis, higher acuity when it comes to census. Can you tell us a little bit how the system is doing overall from an operational perspective? You still have to take care of your traditional patients on a day in and day out basis. How are things going?
And thanks, Mike. I don't think Upper Allegheny is any different again to other hospitals today. Many of us, including Upper Allegheny, are required to defer non-urgent and elective cases due to the hospital's census and the regional COVID infection rates. This impact all of us, and certainly the financials related to the hospital as well, all at the same time that supply and salary expenses were climbing. In January and February of this year, we experienced significant financial losses. We're now in recovery mode, and we will make up those losses in the months ahead to meet our budget imperatives. With successful recruitment and retention efforts, we anticipate being able to reduce the utilization of agency staff, and we'll focus on getting our services back to pre-COVID levels where we can. It's important to note that we have a number of new physicians who, because of COVID, have not been able to start at a pace they prefer. They're hungry and they're ready to jump in.
That's great to hear. And I know you've talked about those new physicians coming into both Bradford and the Olean communities, but that seems to be part of an overall transformation plan for the organization. There's been a lot of discussion in the community about the transformation of Upper Allegheny or the changes at both Bradford and Olean. If you can, you don't have to go into great detail, but can you explain to the viewers, maybe from a high level, what's the philosophy for the change? Why is there such a need to change and transform and protect healthcare in the Twin Tiers?
And rural hospitals had struggled financially for a number of years, and we've seen rural hospitals close across the country at an alarming pace, which is extremely sad as we provide services to some of the most vulnerable populations. For many rural hospitals, operating independently is extremely difficult, and partnerships with tertiary centers have allowed many rural hospitals to stabilize financially. Additionally, there are alternative models of care that support ongoing access to inpatient care based upon community need, while still ensuring that there's preventative and primary care services available. Upper Allegheny has worked with Kaleida Health to ensure the community has access to specialists and specialty care within the system and local when appropriate. This is a significant change, but one that will preserve healthcare in many of our rural communities going forward.
What is so different for rural healthcare? For the viewers that may not know the difference, is healthcare delivery really different at a Buffalo General, a Mercy Hospital in South Buffalo versus an Olean or Bradford?
Well, first, I never thought I would be in a long-term rural healthcare provider situation, but my first administrative experience was a great one. The organization was forward-thinking and provided me with invaluable insight on a culture that can be replicated in larger facilities, but is exaggerated in a rural environment. We take care of family, be it our community family or our colleague family. We may be small, but we are mighty. We have an opportunity to make a difference in people's lives, and we see our work efforts when we go shopping or go out to eat. We're a tight-knit group, and we're proud of it.
Stay on the topic of proud. Last question. Your hospitals, your staff, the community has gone through an awful lot the last 2 years. Chance to say a few words of thanks to those different constituencies here. What's your message to staff? What's your message to the community as we end here?
I'm extremely optimistic for the future. We've met some really tough challenges over the last few years, and we've not faltered throughout. We're only going to get better and greater, but we need the support and really need to work at a team effort, which I think is something that is really replicated here at Upper Allegheny Health System. We have each other's back and we move forward, and we're there to support the community going forward. I could not thank folks enough for the support that they provided us during this very difficult time.
Mary LaRowe is the interim CEO of the Upper Allegheny Health System. She's also the CEO of Brooks TLC Health System. Mary, thanks for joining us today.
Thank you, Mike. Appreciate your time.